Hello, Sojourner Health Clinic volunteer. Welcome to Osler, an open-source, browser-based electronic medical record system developed at the Washington University in St. Louis by students for students. Hello, and welcome to the video on creating a basic note for the patient assistance program. Once you're in your patient profile, go ahead and select Write Note. Remember, for note types, the standard medical note is a typical workup. We're discussing the basic note, the free text internal memo for ancillary departments, such as the patient assistance program. Go ahead and characterize what type of PAP note this is. You can find a full description of all the various PAP notes in your PAP folder. This is going to be a PAP refill. So there's multiple text options that could occur. If the medications arrive on this day, for example, and you do a PAP pickup, you might write order received from, which order was it? It was the order from October 2nd, 2019. And what was in the order? Proventil and Dulera. Always include the prescription number, Proventil, whatever that number is, and the prescription number for the Dulera, whatever that number is. Whenever you receive a medication, you should always document the prescription number into the EMR. Another instance that might occur is if the first or second refill is given on this day. For example, refill number 1 given for the patient's Asmonex. This is how you would document that. You could also do the same thing if refill 2 was given. Now, if refill 3 was given, this is not just a refill, it's a refill and a reorder. As a PAP volunteer undergoing training, you know that after 3 refills, we must refill and reorder 3 more refills. And you're going to document if this was done by phone, if this was done by new form, or by some other method. And as always, don't forget to document which medications were actually refilled. So for this particular note, it was the Proventil and Dulera refill number 3 that was given, and then 3 refills of Proventil and Dulera were reordered by new form. Other possible text options you might write are if there was an issue. If you had an issue refilling by phone and the PAP director needs to call Merck, you're going to write reorder not complete. And then go ahead and explain your issue to a memo to your PAP director and let him or her know that they need to go ahead and address this issue. Possibly they'll need to call the company outside of clinic hours. Another possible scenario is if you have a new PAP patient. Then you can go ahead and write 3 refills ordered by new form of Asmonex. You would also make sure in the title that it was PAP new patient order. Another option is if the medication was returned to dispensary. As a trained volunteer, you know that if the patient hasn't returned in 6 months, their medications are returned to dispensary. And that's what you would document. Their Asmonex 2 and 3 were returned to dispensary because it had been up to 6 months since they last picked up their refill. Lastly, if we have a new patient today and we document that we ordered new medications, however, they don't receive PAP meds today, you can also document that Proventil and Dulera were given from dispensary. Remember that this is also intaked and inventoried in the drug inventory by the pharmacy students and pharmacy team. So that's how you actually document a basic note. As you scroll down, you go to basic notes, you can view a history of all the various PAP and other ancillary department steps. You could press the note to view exactly what was done. And this is a running list. The last thing I'll mention is if you'd like to make an action item, please see the action item video. For example, you can put an action item as soon as you receive a patient's medications. As you're creating the brown bag for their inhalers or their Januvia, you will go ahead and create an action item for 6 months after the medication arrival date to return PAP medications to dispensary. An example of this is right here. Patient had not picked up PAP meds for 6 months, so there was an action item. 6 months happened, and then it was completed. The meds were returned to dispensary. And that is how you create a basic note for the patient assistance program.